above, extinguish fear, rise above.
Guys, welcome back to Rise Above. Thanks for everyone that's been tuning in and sharing the Pizzagate Chronicles. Lots more to come. That's an evolving story. I wanted to make a video today because there's a lot that's happened in the last week, and yesterday, Friday, was a monumental day. Now, this video is going to be COVID, what the fuck is going on? Now, for a lot of us that have got open eyes, that can read, that look behind the mainstream narrative, it's been blatantly honest for a very long time that the figures are being manipulated. At the start, I'd say it's arguable about which way they're being manipulated. Right about now, I would say there is no argument. A lot of us have known for a good 8 weeks maybe that the deaths are being misreported in the UK. There's been so many anecdotal stories coming out of people dying of heart attacks, elderly people dying of dementia, and then going down as COVID-19. Now, before I talk about what came out yesterday, let's cast our eyes back about 6 weeks, because this did start to creep into the mainstream media about 6 weeks ago, yeah? Now, it's very interesting. What's happening in the UK is now directly mirroring the US. Before, we were about 2 to 4 weeks behind. Now, 0 Delta. We're actually running at real-time Delta, yeah? So check this out. The Telegraph. This is from the 21st of May. Tens of thousands of coronavirus tests have been double counted, officials admit. Now, did everybody miss this? This was in the Telegraph on the 20th of May. The Department of Health and Social Care have confirmed the double counting. So in the first couple of lines, double counting, they're admitting at least double counting these figures. Almost 350,000 more tests have been reported in the government database than people tested since the start of the pandemic. What? I'll read that again. Almost 350 more tests have been reported in government data than people tested since the start of the pandemic. Now, to me, that means they've made up 350,000 tests that haven't even taken place. Wow. Okay, so that's from the UK. The next one, again, 21st of May, 22nd of May, updated the 3rd of June. The CDC, now the CDC, the Center of Disease Control in America, they're their sort of main governing health body, similar to what we call PHE, Public Health England. Remember that? The CDC, Center for Disease Control, has been lumping together tests for active coronavirus with tests for recovered patients, double counting, boosting total testing totals, but muddying the pandemic's course. No shit. Right, now there's a quality little bit here. It just doesn't make any sense at all. All of us are really baffled, said Natasha Dean, a biostatistician at the University of Florida. Now, it's come out in the last couple of days also, I'm jumping the gun here, that Florida is the main part this has been happening. Florida, as we know, is a huge swing state when it comes to US elections, and they basically reckon that Trump's victory in the last election, 2016, was in a big way down to swinging Florida. But it seems like the CDC official said Friday they would work to separate them from the results of the diagnostic tests, which detect active infections. One of the agency's data tracker websites had been lumping them together. So it seems what they've been doing, they've been testing for active infections and been doing antibody tests for people that had been previously infected but produced antibodies, and they're just lumping them together and putting them all as infections. So essentially double counting, but we don't know if it's double counting, because the people with antibodies could have been more than the people that were infected, more than double, triple, it could be less, we don't know. So that's what was happening back in May and June, which brings us forward to yesterday. This is where it gets good, and I'm telling you, this is not just happening in Florida. 2 more states are also involved, and it will be a lot more. By 15th, Florida hospital admits its COVID positivity rate is 10 times lower than first reported. That's not double counting, that's counting to the power of 10. Holy shit. A Florida hospital handling COVID-19 tests confirmed to the media this week its nearly 100% positivity rate was overstated by a factor of 10, raising already heightened concern in the state about the possibility of over-reporting of the numbers of confirmed infections. Remember, Florida is the state that opened up first, let everyone on the beaches, let everyone go back to work, open the bars, and then it had loads of testing, loads of positives, and it shut down again. Well, it turns out that 90% of those positives were false. Now, as we've all suspected, and I've been saying for a very long time, everyone's scoffing and laughing at me, what's going on in the UK is mirroring what's happening in the US. And yesterday, we saw it exactly. BBC News, Matt Hancock calls for urgent review into coronavirus deaths in England. Oh really? Perhaps he's a little bit late. What does it say here? It follows confirmation from Public Health England, PHE, our equivalent of the CDC. They've reported deaths may have included people who tested positive months ago before they died. So remember, Public Health England are recording people that tested months ago, and then they can die of anything. Other UK nations only include those who have died within 28 days. Well, that's bad enough. So Scotland, Wales and Ireland, if you get coronavirus and you die of anything else, including in a plane crash or a heart attack within 28 days, you go down as coronavirus. But in England, there was no 28-day limit. Currently, the death measure limit counts all people who have tested positive for coronavirus and since died, and with no cut-off between time of death and date of birth. There have been 40,000 deaths linked to the virus in England. Wow.
If it keeps going the way it's going, I have a chance to break.
The reason that anyone who tested positive for coronavirus but then died at a later date of another cause would still be included in the PHE's COVID-19 death figures. By this PHE definition, no one with COVID-19 is allowed to ever recover from their illness. I'm going to repeat that. By the Public Health England PHE's own definition, according to the BBC and Professor Hennigan, who's doing this report, the definition from PHE says that if you ever contract COVID-19, you will never recover from the illness, and even if 10 years later you walk across the street and get hit by a bus, you go down as COVID-19. Now, I wonder why people like me and thousands, hundreds of thousands and millions of others have been shouting at people for the last God knows how long that this is being blown out of all proportion, and they're telling us how they're doing it. This has been admitted off the cuff in interviews, in documents for a long time. Lots of little tidbits of information. I can hold them up and show them to people, but most people will not believe it until they see it right here on the BBC. We need correct and accurate statistics so we can really understand the trend. Otherwise, it's very difficult to know what's going on. Wow. How long did this guy train for his PhD to be able to work out that it's very difficult to work out what's going on if everyone that has ever had something similar to a common cold and then dies of a heart attack 20 years later is put down as dying from a common cold? That is going to be pretty confusing. So, figures from PHE show that just under 10% of coronavirus death in England happened more than 28 days after the positive test. So, that 28 days window of opportunity that they've got in Wales, Scotland and Ireland, which is ludicrous enough, only 10% of our deaths were outside of that. So 10% of 40,000, well there's 4,000 deaths. 4,000 deaths. In almost half of these, COVID-19 was recorded as the main cause of death. Oh right, so it doesn't even have to be the main cause of death. After a month after you've had it, it could just be the other cause of death. This gets weirder and weirder and weirder. This could explain why the UK death toll in England has remained higher than other nations, you reckon? Scotland, Northern Ireland and Wales only include the deaths if their count is within 28 days of a positive test. Well, that's stupid enough as it is, but if it doesn't mean that the most of England's coronavirus deaths are counting errors. Oh really? Thanks BBC for pointing that out. It doesn't actually mean we're counting errors. Statistics say it's better to look at death registrations than pick up coronavirus cases that were never confirmed by a lab test. I'm going to read that again because this is from the BBC. I'm going to read that again. Statisticians say it's better to look at death registrations, so that's the death record document, than pick up coronavirus cases that were never confirmed by a lab test. Well, how would you pick up a coronavirus test if it was never confirmed by a lab test? You would look on a death registration that just said coronavirus. But it's already come out that to go on your death registration, you don't even need to have had a coronavirus test. You just need to have had flu-like symptoms and died in the hospital. This is getting weirder and weirder and weirder. What we're basically painting a picture of here is a criteria for COVID-19 death that is so loose, it could include anyone in England, let's say, that has ever tested positive, bearing in mind that test says on it that if you've had something similar to a coronavirus, which includes common colds, they're coronaviruses, that could provide a positive test. So if you've ever had one of these tests any time in your life, you die of anything, you die as coronavirus. If you test positive for coronavirus and you fall out of a window and splat on the ground, you die of coronavirus. If you die in hospital of pneumonia, and which is flu-like symptoms, and you don't have a coronavirus test, you also, it's going to be pretty difficult not to die of coronavirus. And we're worried about these 40,000 deaths, 29,000 of which are in nursing homes. I hope everyone, even the most intrepid fence sitters, are starting to really question this. I really hope they are, man. Because what has been perpetrated on us, I'm going to say this now, this is my opinion, is a lie so fantastic, it makes the communist lies about the Chernobyl disaster look like a little white porky. For real, I cannot describe it any other way than that. So, last thing on the misreporting, I'm going to show you this graph that came out with the huge inquiry that Matt Hancock, the guy who knew this was happening all along and basically put these very loose definitions of COVID-19 death into place. He's doing an inquiry, and this is one of the graphs that's been produced. Now, if we look at this graph, this shows daily reported deaths starting on the 1st of May, which was like right in the peak, going down to the 16th of July, which was yesterday, which is towards the end of the pandemic. The red line represents the daily reported deaths by PHE, and the NHS, the blue line represents the NHS. Now, bear in mind, the NHS deaths are reporting anyone that tests positive, even if you've fallen out a window. And the PHE deaths are reporting anyone that has ever tested positive for COVID-19, even if you fall out of a window a month later outside of hospital or get run over by a bus. So the blue line, in every case, is at least half the length of the PHE number. So the already inflated NHS deaths, by this ludicrously loose death criteria, are being at least double counted. In some cases, by the look of this graph, they're being triple or quadruple counted. So the already ludicrously inflated NHS death rates are being double counted again. And that's where we've got our 40,000 deaths from. I'm going to say now, by my own estimations, by all of the research I've done into all of these figures, from the WHO, from the NHS, from ONS as well, I think that the death rate, the actual death rate of COVID-19 has been increased by at least 10 times. Now here's the big question. If this is such a dangerous pandemic that you need to shut down the world and quarantine people and lock people down and impose social distancing, if it's that dangerous, why do you need to lie so badly about how high the infection is and how high the death is? So, if you're still with me, I hope you agree that I've basically just showed evidence that the PHE and the CDC are both inflating the infection rates and the death figures, arguably to the power of 10. I think higher to the power of 10, in my opinion. Both our government and Donald Trump are now effectively looking to cut them out. Matt Hancock and the investigation into him and PHE started yesterday. Yesterday, Donald Trump made an order that he's cutting out the CDC from the death rates. So it looks like our governments are wising up to these two rogue medical institutions, advisory bodies, are deliberately misinforming them and inflating the prevalence and the danger of the pandemic. But here's the question: why would they do this? Why would they do this? Well, I have a theory of why this is happening. So now we're going to come away from the stats and we're going to start talking about my opinion. To understand why this is happening, we need to look across maybe up to 5 to 6 different agendas. And I'm going to start with one. It centres around, everything centres around UN Agenda 2030. But the first aspect of this I'm going to look at is ID 2020.